We're here at the UltraWellness Center going to talk about an important topic today, which affects probably like a third of all Americans or more, which is irritable bowel and inflammatory bowel, which is like colitis or Crohn's disease. And I'm here with Dr. Ed Levitan, who joined us recently, and he's had tremendous experience with this. He was trained at Boston University, then Brown Medical School residency program. He's been doing functional medicine for over a decade. He's an amazing physician, trained over 20 docs, ran a huge center. Now he's joined us, which is super exciting. So we both have been dealing with the gut for a long time. We know that's where the money is, so to speak, where a lot of our health problems start, from everything from depression to autoimmune disease to obviously gut issues. We're going to focus today on the actual gut issues like irritable bowel, which affects about 60 million Americans, inflammatory bowel like colitis, Crohn's disease. And if you've suffered from this, these are problematic conditions. They cause a lot of disability, a lot of suffering. And I was just recalling, as we were talking to Ed before, about this patient I had a few years ago who I met on a plane, had severe colitis, was this big city guy and super skeptical. I said, I can fix that if you want to come see me. And I don't need more patients, but he seemed like a nice guy. And I hate it when people suffer, because so many people suffer needlessly. They don't know that there's actually a solution out there that can fix these problems. And that's really why functional medicine is so great. So this guy came to see me. Turned out he had a really bad dairy reaction. He had all kinds of bad bugs in his gut. I cleaned up his diet. I gave him some things to help clear out his bad bugs in his gut. I call it the weeding, feeding, and seeding program. Helped heal his gut. And it's like a few years later, and now he's gone well over a year without any symptoms, no blood, no diarrhea, no pain, and he's not on any medication. He came in on a pile of drugs. So getting these things fixed is really possible, and it's super exciting. In fact, I don't know if you saw the article, Ed. I saw it a couple of days ago, just came out. It was done by a bunch of gastroenterologists out, I think, in Washington, where they actually treated people with inflammatory bowel disease with a specific diet, which is essentially my 10-day detox diet. It's not called that, but it's no grains, it's no beans, no sugar, a little bit of fruit, maybe a little honey, and essentially it's a elimination diet. No gluten, no dairy, and it's got a little bit of fermented cheese and maybe some specially prepared yogurt. And these people got better. It was amazing to see the results. And you and I see this all the time in our practice, right? You've been doing this forever, and I think I wanted to sort of chat with you because you've seen this, you've treated this, you're an expert in these gut issues, and tell me what how do you approach this? And
yeah, so let me talk about like I hate watching people suffer like you.
Yeah,
and
especially when there's like
there's a lot to do.
Right.
So I saw a 50-year-old gentleman that had Crohn's for probably 10 years and had most of his small intestine and part of his large intestine taken out.
Right.
When it was very clear after testing that he had gluten issues, and we could have prevented most of that. I believe we could have prevented most of that.
So he's eating something that caused inflammation in his gut, and their treatment was cut out the colon.
Cut it out. So the other example is the 16-year-old that has had Crohn's for 4 years, and the parents are all up in arms. He's doing okay with biologicals, but he's on medication. He wants to play sports.
These medications cost like $30,000 to $50,000 a year forever.
Yeah.
Right. So if you're 25 or 30, you're talking about millions of dollars to the healthcare system.
Millions of not needed dollars.
Right. Right.
That's the problem. And the nice thing is,
and they have side effects, right? They cause overwhelming infection and death, and they can cause cancer, right?
They suppress the immune system, absolutely. And it's from a stress point of view. We think about the gut and we think about everything from stress.
Yeah.
Because this kid, for example, his parents were divorced. He had a lot of stress from that point of view. That gave him inflammation. Then you have the gluten issue. He had bugs. He had all sorts of things that we had to clean out. At the end, we had to actually do a two-pronged approach. One piece is a chemical piece in terms of taking care of the bugs, the chemistry. And the second is to take care of his emotional issues. Yeah. And really having to deal with both things at once to really make the most profound difference.
Right. I mean, you call the gut the second brain, right?
Absolutely.
It's like the second brain. Most people don't know this, but you've got a whole other nervous system in your gut, and there's more neurotransmitters there than there is in your brain. It's your gut brain.
Yeah, which is why we eat chocolate, why we do a lot of things that actually change our neurotransmitters.
I like chocolate because it tastes good. Only dark chocolate.
Okay, with a little sugar, right?
Yeah, that's fine. So, how would you approach a person like if they came in and had, let's say, colitis? What would you do?
So, first of all, thank you. So, first of all, it's really about starting out with getting a firm history, figuring out what's the story, And then really digging deep. What are the labs we need? Do they have any food allergies?
Yeah.
How are the bacteria in the gut, the microbiome?
Right.
Are they eating inflammatory foods?
Right.
Are they eating artificial colors, sweeteners, all that good
And we do
stuff
special tests here that most doctors don't do, right?
We do a lot of special tests. We do probably 100 to 200 times,
Right.
1,000 times more testing than a regular
Yeah.
doctor does.
Yeah.
Which
Well,
gives
it's
us a lot more
like being a
information.
medical detective, right? You got to find the thing, or you treat everybody the same.
It gives us a lot of information and makes people feel better and do better over and over and over again. It's
Yeah.
just effective.
Yeah.
It's just profoundly effective.
It's so effective. I mean, I felt so bad for this guy I saw today who basically came in suffering for years, like, I don't know, probably 20 years with gut issues that are getting worse and worse and worse. And he started out because he had lactose intolerance and he was eating a lot of dairy and sugar, and his like stomach was super bloated and he had gas and distension, and he was just getting worse and worse and worse. He finally stopped dairy, but he still didn't get better. And I talked to him, and he had I looked at his mouth, he had a tongue that was coated with white coating, and he had lots of yeast on his stool test, and no one had really ever treated him. He had bloating after he ate, he had diarrhea, and so I basically gave him a program which is like a elimination diet, like the 10-day detox diet that I wrote the book about. It's really for patients with gut issues and inflammatory issues and sugar issues. And then I gave him a drug which is a non-absorbed antibiotic to clear out the bad bugs. That's the weeding. I gave him an antifungal because he had tons of yeast overgrowth on his tongue and in his gut. And I gave him some enzymes and probiotics and just some gut healers. And it just, it's amazing. Like, he's going to get better. And I know with colitis, like I don't know about you, but I've had probably half a dozen people over the years come in who their doctor said, can we cut out your colon? They want to cut out the entire colon. They're left with a little bag or maybe they'll have diarrhea the rest of their life. They'll connect up their colon, their upper intestines to their rectum. And literally they were about to get their colon cut out, and in weeks, they were just better. They had symptoms were free, and they never got their colon out. So imagine the suffering that causes.
It's amazing what we can do, and we are not taught that in medical school.
No.
And we can help, literally. Come here, help. Let me help you.
That's right.
I walk like you, I talk to people on the street, and they talk to me about their problems. I'm like, just come here. Just give me 20 minutes of your time, an hour of your time.
It's true. It's so frustrating because people talk to me and I go, it's like, I know what's wrong and I know they're not getting the right treatment.
Right.
And the problem is I can't see everybody because I only have one person. That's why I got Ed here, because he's now able to see patients here at the UltraWellness Center. I encourage you to come, check it out.